Welcome everyone to Prevention and Self-Help. This podcast, we're here to explore ways to prioritize mental health and well-being. My name is Henry Burrell and I'll be your host for this episode, and we're thrilled to have Saucity Lewis, Chip Carroll, and our special guest, Sonny Harris, who happens to be a counselor at the Beck Center for Veterans, as well as the Howe Service Center here in Jonesboro. Saucity and Chip are both program directors for Research Solution, and they are your regional prevention providers for Northeast Arkansas. So thank you everyone for being here and welcome.
Thank you for having us.
No problem. Okay, so the focus for this month are kind of like in 4 key aspects of mental health, right? We want to do more by understanding what mental health myths are versus facts, how to manage stress and different techniques that are there, how to build resilience, and then to explore kind of like where your resources are in the community. And with that, I want to start with the first question, which is, what are some of the mental health myths versus facts? And what would you say to someone that are the most common myths versus facts?
Well, there's 2 that I can think of off the top of my head in regards to myths. And that is, the first one is therapy is only for people with severe mental health issues or if they only have severe problems. And the second one would be that therapy is expensive.
Yeah, those are pretty common. I can tear someone away if they're like, well, I need help, but it's too expensive, so I don't know what I'm going to do.
Right. And then if you're thinking that, oh, I'm just got the SADS, I just got the blues, I'm fine, I'm not suicidal, I don't need to go talk to somebody.
Well, then you run into the stigma of mental health of what if you do get that diagnosis of depression or anxiety? And then you're looking at, a lot of times our family members, like our grandmothers or our aunts, would have depression, but, that's almost 40 to 50 years ago, and treatment back then was so much different than it is today. There's different medicines, there's different ways to treat yourself, there's different techniques, there's different styles, and so you can find that help.
And so, like, if we're looking at, like you're saying, the labels, that stigma, and it can be overwhelming. And with therapy being expensive, there are options that you can use your religious group leaders. You can use your PCP, talk to your doctor and let them know, hey, these are some of the issues I'm dealing with.
You can talk to some of your
coworkers.
You can talk to your teachers.
And there are options. You can, your trusted friends, family members, sometimes.
But you also got to be careful when you start shopping around, looking at people, because you got to find someone who won't judge. Because you might go to a certain friend and you'll have a certain type of relationship, and you tell them that you're struggling, and then they may want to judge. Even though that's just your relationship. Finding a therapist or finding someone to help, it's kind of like dating. Even
one of the things that they talked about in the program is that, finding that therapy style that works for you, it might take you a few different ones.
Yeah. Or finding that friend that you can lean on in that way. It can take you a few times.
So making sure that, it's interesting you say, I can go to my primary care physician, I can go to a mental health professional. But you're also recommending that just the people in your community, the people that you do life with, are also can help in those terms. Yeah. And when we get into the next segment, I wanna tap into that. But why do you guys think that these myths persist? And then how does education play a role in dispelling some of these myths?
And the biggest one is fear. And with that education, it helps eliminate or lessen the fear.
I won't say eliminate, because you're still going to have that fear. I mean, even someone who is educated and someone that sees a counselor or a therapist on a weekly basis still has that fear.
I can attest to that as somebody who's in the mental health counseling field, as well as a student, and I'm a client too. And that's part of that stigma too, is that, kind of going back to what we were previously saying, that you can only go if you have severe issues.
Yes.
I've got some mental health issues, but not so severe that it's debilitating. It's more of just having that safe space for somebody to talk to.
Me and my wife, we see a counselor once a month, marriage counselor once a month, and it's just for maintenance. We're not into anything major or big. We just go once a month. It's a free space. It's non-judgmental. We can say what we need to in a safe space.
Right. So going back to the philosophy of if I don't feel well, physically I'm nauseated, whatever, I go see a doctor. If I break my arm, I go see a doctor. So I'm not feeling good, I have a persistent cough, it's not going away, so I'm going to go seek some help. It's the same idea, because I do think that people kind of like have this gradient of what mental health issues are, and they do tend to think about it's not severe because it's not debilitating. I can get up and go. It's not anything that's preventing me from being functional, but you still carry some stuff around with you. So my next question is this: what actionable steps should our listeners take, or can they take today, to challenge some of these misconceptions in their own lives or in the community about mental health?
I think the biggest step with, making those changes, it's acknowledging it. Acknowledge it within yourself.
Yeah.
It's like, I need a little help. I need that safe space. I need that helping hand.
Because the help is only going to work if you're ready for it.
100%.
Yeah. Because if you're not ready for help, then it's not going to work.
It's going to go in one ear and out the other.
And that goes back to what we were talking about with the myth itself. If you're not, you have to be ready, and you have to be accepting of it to get that help.
So the first step should be acknowledging the need and the want for the help. Because sometimes you need it, but you may not want it.
Okay.
Sometimes you may want it. You should still get it.
Okay. So just to paraphrase this part, right? Some of the myths, some of the bigger ones, is that, one, I have to have this big issue, the debilitating issue, for it to be worthy of going to see somebody. Two, it's expensive. That's the other one. Those are the two biggest ones. When it comes to why this persists and the role that education plays in dispelling it, is that, one, people have to overcome their fear of the fear of being judged or being labeled, correct? Or just being in that category.
Because sometimes it's not necessarily that, you may not even tell anybody you're going to therapy. You may not even be feeling like you're being judged. But it's just that fear of that change.
Yeah.
Change.
Of doing something different, or even doing something for yourself.
This is the most important step, is the first step. That a step needs to be taken. You started out by saying, acknowledge that something's not quite right. And then going to seek help. And then I think, Chip, what you were saying was that's a process.
Yeah.
Like you have to find someone that you feel comfortable with, and non-judgmental, who has the ability to be empathetic and be in the same space that you are. I think all of those things are important, and I think it's also a good way to segue into our next segment, which is going to be on stress management. So thanks for the first part, and we'll see you in part 2.